Okay, so we're going to be walking through how to engage our deep core. So essentially what we're trying to work on is engaging the transverse abdominis muscle, as well as the musculature on top of it and our pelvic floor. And in so doing, we kind of get this kind of zipping in and up effect, which is just a nice activation of that pelvic floor, taking pressure off of some of that lower musculature. So to start with, I just want you to put your hands on your belly, and we're going to just start breathing into our belly. So hands on our belly, we are going to be just filling our belly with air. I want you to actually place one hand. If you follow your ribs to where they meet in the middle, we're going to have one hand there and one hand on our belly. Okay, so I want you to breathe in. Nice and easy. Exhale through your mouth. If you are able to breathe in through your nose, let's try that. If you're not able to, don't stress. Just let that air come in any way that's comfortable for you. Now, the key with this is that we want the belly to be expanding as a byproduct of our diaphragm moving. So to break that down a little bit more, my diaphragm is lowering as it lets my lungs fill with air, and then my belly is just raising to make room for that air. But what's not happening is I'm not pushing out my belly muscles, okay? So these are staying pretty nice and relaxed. I'm not working on bracing yet. I'm just trying to kind of feel the air move and feel what my body's doing. So let's now focus on that space between our rib cage where our diaphragm is able to be felt. Now we're going to have one hand there and one hand on our chest, okay? So now we're going to try a little bit of a different technique. This time, I want you to see if you can press your breath into your diaphragm first, and then I want you to try to fill your chest. Now from here, you're going to try to let that air out of your chest, but keep your diaphragm full, and then let that diaphragm lower. So this is called umbrella breathing because we kind of imagine opening an umbrella from the bottom and it closes kind of from the top. So one more time, we're going to breathe into the diaphragm. Let that chest rise and expand. Let the chest lower, and then the diaphragm lowers along with it. Good. All right, and now let's just take a moment to relax here. So when we are just focusing on breathing, it's not about taking huge breaths. It's not about taking breaths deep, deep into your belly. What we're really aiming for is just getting nice kind of full expansion of our rib cage and just kind of nice up and down movement of our diaphragm, okay? So now we're going to move into how we tie that into our deep core activation. So to start from here, we're going to find the boniest part of our hip that sticks out, and we're going to let our fingers travel inward toward the middle of our body just a little bit to where it's nice and squishy. So then from here, what you're going to do is imagine you are fogging up a mirror. So you're going to go, and you're going to see if you can get that muscle to kind of pop up under your hand here. Okay, so let's try again. And then from here, you're going to try to hold that muscle up. Now, the key here is that we don't want to, again, be pushing out the belly, forcing that muscle up, because that's a lot of pressure. And we're trying to actually bring that pressure back upward a little bit. So we're going to try a nice kind of mid-range huff where you're not feeling like you're blasting pressure out the front of your core, but you feel like it's popping into your hand a little bit. On that exhale, and then let it go. Try again, exhale, and then let it go. Good. Okay, so then from here, what we're going to do is get into our pelvic floor, and we're going to try to connect those two muscles. So imagine that you're zipping up your coat. That's where we're going to start at the bottom of that contraction, and we're going to try to zip it up and in, okay? So we're starting at our pelvic floor. One of the easiest ways to think about it is imagine you're trying to stop yourself from urinating, stop yourself from peeing, or stop yourself from passing gas. So if one of those is easier for you to connect to, start there. And then what you're going to do is as you got that connection, you're kind of zipping up. You're going to think about pulling those two bones of your hips closer together to get that same contraction that you felt when you huffed. And then we're going to get this nice drawing in and then let it go. Good. So from the side, what you should see is that if this is my relaxed belly, as I do my contraction, things kind of tighten inward. But you'll notice that I'm not just sucking in my belly. It's a little bit more subtle, and it's not just a pulling inward. So I am thinking about a little bit kind of pulling my belly button to my spine and pulling inward. So you'll know the right contraction is happening if you try recording yourself, if as you contract, you see everything kind of pulling inward, but you don't see any flaring outward, okay? It shouldn't feel really super intense. It should just be a nice gentle contraction. A nice way to practice it is inhale, relax. Exhale, try to find that contraction, okay? And then let go.